So, are we
Yes,
live? I
yes,
think we
yes.
are live. Okay. Hello, everyone. I'm Doel. I'm a clinical embryologist and an IVF lab director at Indore Infertility Clinic. And this is my first and hopefully not the last live. It's too much of hard work, actually. So, thank you, first of all, everyone who has joined me and about to join me to show your support. And I understand that Sunday afternoons are the only me time that most of us get. And I hope that, being on this live will be worth the me time that you will be sacrificing on. So thank you for showing that support. Um, so I have been an active contributor to social media content in the last, I think, since its inception. But my contribution has been towards the silent side. I would call myself a social media spectator or a stalker, actually. I stalk people. I don't put too much of content. And I have felt this huge self imposed stress mostly by seeing most of the people making the most of social media for their professional goals. So I thought, let me design my own thing, my own way of being on social media without, compromising on my moral ethics, modesty, whatever values you call them, which are actually, I think the definitions have changed over the years. I may not be good at doing this, and that thing on Reels, but I hope that I'm okay doing something which comes very naturally to me and which is talking. So here I am with Beyond Norms. I gave it a name so that it would suit the title of what we are going to go through. I wanted to have an fluid, uninhibited, and unfiltered conversation, and that is the reason why I'm doing a live, because I want it to be unscripted actually, and both in Hindi and in English. अभी मैं हिंदी पे उतरूंगी, इंग्लिश की गाड़ी में से उतरूंगी तब हिंदी पे उतर जाऊंगी. And to give it a feel of a talk show, I went and designed my own cue cards, but मुझे इसको flip करना नहीं आया कैमरा को. So I'll have to learn that setting sometime after this live. I really don't know how to flip it on a video. I tried, it didn't work. And the second thing I did was I went ahead and bought a fancy filter, a camera phone with nice filter. I bought a OnePlus, but apparently YouTube live पे filters काम नहीं करते हैं. You can't do much with it. पता नहीं था वरना इतना investment नहीं करती. So, okay, getting on to the show directly. So my first confrontation, I called it a confrontation. I think Jay, more than you, I'm getting a call, so I'm declining it. Okay. You can't be on airplane mode either when you do it from a mobile camera because of going live. So yes. So I think Dr. Jay Mehta, you fit the title of going beyond norm very aptly. You are the first person that came to my mind when I thought about doing this series. And let me introduce you to the to our audience today. So, Dr. Jay Mehta, and I'll call you Jay. By the virtue of my age, I hope I can call you Jay.
Everyone calls me only Jay,
Okay.
so that is
So
how
he's
it
a
should be.
okay. All right. So there you are. So for the audience, Dr. Jay Mehta is a prominent gynec endoscopic surgeon. And for clarity, for people, those who have joined and who are not from a medical background, I would like to clarify that endoscopic surgeries are ones wherein you don't need to open up the entire abdomen to do surgeries. You just insert some tools with some nice cameras and do some magic inside, and you come out leaving minimal scars and a quick recovery time. I hope I sold the endoscopic surgeries well. So yeah. So Jay is going to tell about that later on. So he's one of the, in last, I think it has been what, 10 years since he has been actively practicing. And he's one of the most, what do you say, um, uh, for the lack of word, one of the most famous, especially on social media, surgeons in the country. And he's dynamic, thought provoking, and has an unapologetic, bold approach. I would like to introduce Jay as somebody who has a controversial voice in this field, but he has an undeniable fan base. I think I just Googled some and found out that you have multiple YouTube channels. One of his channels has 333K organic subscribers. That is a huge amount of subscribers. And the other one, I think I just recently saw, had 200K subscribers, which is more of a teaching channel. So, when innovation meets medicine, Dr. Jay Mehta is a trailblazing surgeon and an impossible to overlook. So, you may love him, you may hate him, but you cannot ignore him. So, here you are, Dr. Jay. Welcome to the show. And the first conversation, I want to roll it around a question, which is that if I'm not wrong, I think it said that you have been actively practicing since only last 10 years. And the feat of uh, being where you are today, I think social media also has a huge role to it. I think I would want you to explain how did this entire idea of coming live on social media with surgeries come to you, and how did this entire thing occur? Like, was it just an idea or it was planned? What was it? Over to you, Jay.
Honestly, so first of all, thank you for this wonderful introduction. And see, what was happening in our curriculum was that uh, if in case somebody is talented, then only a few people were allowed to project their talent at national platforms. Whatever it could be politics or it could be regionalism, and people would not like a new guy coming inside the system, or no matter what you try to call it. But the doors were closed, right? So we were like, if the doors are closed, then we will create our own doors. Understanding, and that is how this idea. I did see a few people going live on social media platforms as far as streaming content of the shows is concerned, the rock shows and the movies, and the live movies. So we were like, if the rock show and a live movie can be streamed, why can't we really stream our surgeries? Because this is also like a movie. A surgery is like a movie, so why can't we really stream it? And I mean, as it started, I mean, we started this in 2019, and then came COVID, where we became an overnight sensation, and ever since then, uh, it's only been looking upwards. It's like that.
I think your voice is breaking a bit, but I hope that it will be a stable connection in a while. So, what kind of preparations did you? So, you went ahead. Did you yourself? Did you have a team at that point, or you yourself went ahead and did all the
Yeah,
research and
yeah.
decided
When
how
I
to go?
started, there was no team. Obviously, now there is a team of 4 5 people to do it. But when I started doing it, I was alone. So I had to put in some mind and thought into how to get it done, what type of connections we need, what type of internet bandwidth we need, what type of consents we need. We went through a lot of brainstorming in all these things, because you need to do a lot of these things before you ensure that you are hitting the right chord. Because if you are doing something wrong in this field, then you can be taken to the task. So we ensure that all of it is done correctly right from the first surgery itself.
Okay, I think you did a pretty good job at it. One other thing I have seen, I think I was introduced by one of my fellow embryologists to your service. Laparoscopy is not even my domain, but he just mentioned that, you should watch how Jay Mehta does it. You were doing TISA at that time, and I saw them and and I was literally blown away. I said, "Oh my God, this is something." But at the same time, I would be very honest. I have been following your social media profiles and posts because those get pushed as notifications. So most of us avoid confrontations. I am the last person to to say anything. सोशल मीडिया में तो और भी दूर भाग जाते हैं. मैं कोई कॉन्फ्रंटेशन नहीं डील करती. तो हाउ आर यू सो वोकल? आपको कभी डर नहीं लगा कि इतना वोकल हो जाऊंगा तो पीपल माइट नॉट लाइक मी? और आपको किसी ने मना किया नहीं किया, आपने किसी की नहीं, हाउ हाउ डज दैट हैपन? आप कॉन्फ्रंटेशंस को ऐसा डील कैसे कर लेते थे, वोकल कैसे हो जाते
No,
हो
no, honestly,
आप?
honestly,
इज दैट जस्ट inherent to you?
honestly, it is not about that. See, when you are right, you have to take a side of being right. It is as simple as this. Got it? When you are wrong, तो तुम चुपचाप गलती accept करो, सुन लो, सुधर जाओ. Correct? When you are right, if I tell you that I am a man, right? I don't really need to prove it to you that I am a man, है ना? And if you consistently go and say that अरे he's not a man, he's not a man, he's not a man, he's not a man, so then one day I'll wake up and I'll tell you, right, that look boss, now enough is enough. uh, stop telling about all these things, right? And that is how it is on social media. So as long as you are true to your profession, as long as you are doing the right thing, and if somebody is acting stupid, doesn't really mean that you don't say anything. If they are right, they will also speak up. It's as simple as that. Where is the question of
But I'll be very honest and I'll tell you something that even if, like, WhatsApp is a social media platform, right? So even if there are people who are saying something wrong to me directly or maybe indirectly, at times there are many people like me. I'm not the only one. We are not that vocal. We feel that we would want to avoid a social media confrontation, honestly. ऐसा ही होता है. This is how I think this is how we are trained हमारा एज में ऐसा
it's
तो yeah, so I found you very vocal, and I think I there are parts of it that I like about it. Sometimes I disagree, but yeah, you stand to your point that I completely understand and appreciate. So one thing, tell me, Jay, that has social media platforms like call it Facebook, Instagram, YouTube, whatever, WhatsApp, has that helped doctors more or is it helping patients more or both?
if a doctor is doing it from the point of view of academics, it will help the doctor. If the doctor is doing it from the point of view of business, it is not going to help the doctor.
Okay. So even in long run and short run, it's not going to help the doctors if they are doing it for the point from the point of view of
No,
getting
I don't think so.
business, right? Is that
Yeah,
what you're
yeah. I
trying to
don't
say?
think it will help anybody get more business than what they are already getting. That is not possible. I mean, you may get more visibility. You may not get more business. Okay, business is purely driven by your past results and your past outcomes. Business cannot be driven by your marketing.
Is that visibility what most patients also look for things that are highly visible, or do you not
I don't
agree
think
to
so.
it?
So if in case you try to look at any services which anybody is offering, there are so many services which patient doesn't really want to even get a notification about. You know, so that is the reason when you are looking at health
Mhm.
as a social media enterprise. Okay, let's say if I have 3.5 lakh subscribers on a channel, actually the number of people watching me are 100 times more. It's going to be 3.5 crores. Okay. The number of people who will subscribe to you is probably one by 70 or 1 by 80. The reason for that is because people don't want that notifications to be pushed to them. They don't want it.
Right. Absolutely agree. Even I don't like it, and it almost killed me when I had to push through multiple groups to even, forward a live notification or something like that. I don't like it either, and I agree that people don't like it, and patients are people. So I think, do you agree that patients, when they see such things, like, of course, not the channel which is for academics, that they will have no interest to, but whatever content you have on social media, say, hi, kaise hota hai, kya hota hai, and all that kind of thing, do you think it is beneficial for patients too,
Patients will always get
as compared to what it
patient. A
was
patient
before?
will always try to hunt for multiple sources of information. Okay. See, a patient understands only 1% of the disease. The patient doesn't understand the remaining 99% of the same disease, what he or she is trying to look out for. So typically what I understand and what a patient tries to see in any content, okay, is the purity of content. You know how pure the content is, how honestly the person is trying to communicate to me. Like, how honestly the doctor is trying to say that, you need to do this, something like that. That is what the patient is predominantly looking out for. The patient doesn't really end up looking out that, I am operating in Bombay and I am operating in now Indore also, and now I'm operating in Delhi also. Patient doesn't care of all those things, honestly. Okay, they honestly don't. They are just looking out for how honest the content is. So, there are so many content which are created that if in case you want an appointment, you call on this number. Okay, that is the those are the
Yeah,
videos which get the least number of references.
agreed. Agreed. So let's get back to surgeries because that is what is most radical about how you practice. So when I, as a patient, before embryology, I was a patient first. As a commoner, I would think that surgeries are done purely when you have a distraction-free environment and when you are absolutely focused and all that. So do you think that you do or perform better when you know that your surgeries are live? Because for me, it's the same way. When I do my HC, I record them. When I record them, I do much better than when. So do you think that happens to you? Do you do much better when you know you're going live,
See, now it doesn't affect us anymore.
or it's the
Now it
same?
doesn't affect us anymore. But then in the initial stages of the career, we were thinking like that. At this point in time, we don't think like that at all. We are okay.
Okay, so it doesn't matter whether it's live or not live. It's the same thing for you. You're not conscious of the fact that you're going
Not
live,
at all.
right? Okay. So tell me, for all those young professionals, doctors especially who have joined and who want to be doctors, what are the pros and cons of being on social media as a profession, as a doctor? So tell me about some pros and some cons.
As I already told you, the greatest thing which it will offer to anybody is visibility. Okay, so that is the greatest benefit which social media gives you. The negativity is lot of people try to get it into a very commercial aspect, and the minute they get into the commercialization of that, they are going to see their downfall. So that is just something which people need to be careful about.
Okay. And do you think it's addictive? Watching social media is definitely addictive, but is creating content on social media also addictive? Do you always want to be live, doing
It is
things
very very
live? Do you
tough.
think it's
It
addictive
is
for
very
you?
very tough to create simple content on social media as a healthcare professional. Okay, it is very very tough. It is very very tough. So I try to do it once in a week now, not more than that, because I don't get the time. But if I'm given time, like if somebody gives me like go 4 days, I'm giving you time to create content, then I would love to do it because I like to do
Yeah.
it. It is something which I like to do.
Right. I think if you were just creating content, then it's different, but you are also working and at the same time have the pressure of creating content, which leaves you short of
Yeah.
time, right? Okay. So do you think it is important for doctors to self-manage their brand name using
No,
social media
you
as
should
a
outsource it.
tool or
You should give it to
okay.
people.
So
You
when you
should give it to
outsource,
people who will apply their brain better than what you will apply your brain.
okay. What are some tips and tricks? You have done this for the longest time that I have known and consistently. People are usually not consistent. You will hire an agency or something, and then
You will not
when
get
the
results for the
contract gets
first
over,
thousand
it's
days.
not
So you have to keep quiet for the first 1,000 days. Now, if in case you do not change your agency and keep quiet for the first 1,000 days, you will end up doing well. That is the tip.
okay. Okay. And you think that, for the people who are new into this, um, what should they be concentrating on? When you say you are creating content, it is just about you are highlighting your skill, right? So basically, that is what your aim, your tip is that you
No,
should be focusing on
people
just the skill
people should
and
only
not.
highlight good content. People should only give inform. If I'm speaking to you, I want to learn from you, let's say, how to do ICSI. So I'm only interested in learning how to do ICSI. I am not interested in learning from you how many ICSIs you are doing. Understanding? I don't really care about it. I'm only interested in learning how to do ICSI. So you must understand the pulse of the patient and then create content based on what the patient want rather than what you want to give them. And I think that can help people a lot.
So I have also been after reading couple of posts. Do you have any thoughts about what are your thoughts about these award ceremonies which are being mediated by third-party mediators? Because people who will host it,
it's
you'll have to
it's a
pay them.
profession. Giving
So,
awards is a business, so it is up to people to give awards.
but common people don't get
No,
it,
no,
right?
most of
Like
them,
the common people, they
most of
don't
them
get it.
understand. See, most of them understand. Getting award is a
Okay.
business, giving award is a business. So I mean, it's okay.
All right. So I think we have reached an era where social media, whether we like it or not, is a part of our lives now. We don't want our children to be addicted to it. We don't want any of it, but still, it is here to stay. So, do you think we should have social media engagement management, such kind of a thing as a curriculum in higher standards, higher education
500%.
curriculum? Sorry, I
I said
couldn't hear you.
500%. It should be incorporated.
Yeah. Yeah. So how many people you were just mentioning about
Six
your
people.
team size? You have 4 or 5 people
Six
in your
people in the
team?
team.
6 people. So what are their roles? Like, are they from like just purely social media background, or you think they have this
No, no,
medical
no, no, no.
background
They
too?
are
Some
all
of
from
them.
social media background. Somebody supervises content, somebody does research and development inside it, somebody is curating the content, somebody is labeling it. So everybody has their own roles. Somebody's trying to optimize the content. So honestly, that is how it is.
I think we ran some of one of the opinion polls. Do you have a result? I also have one person in my team. Okay. Um, I had asked I think one of the questions was that if you were being, operated and you knew that the surgery would go live, would you still be okay with it? So, what was the response on that? No, 100% no response on that. Oh, that's
Yeah,
strange because
that
I
is
said
that is how it is honestly.
that is
So for
strange because
whenever we want to go live, let's say on
yeah,
100
sorry.
occasions when we want to go live, the permission is granted only maybe on 10 occasions because 90% of the patients do not like it.
Even if there is pure
Pure
anonymity, they
anonymity.
would not
People don't
like it,
like it.
right?
Honestly, they don't like it.
Hmm. So how do you manage this? Do you like, is it
They are pre-informed and
you offer
they are
them?
pre-informed. There is no compensation to it. And some of them will agree, some of them will not. It's okay.
Okay. All right. I think I pretty much had these questions, and around this, I'm pretty much okay with. I would like to summarize the entire field. See, how I worked towards this was that I knew that you have to be on social media for being visible, right? But beyond that, I think my intention for this is there are so many voices and so many things which are not told. Only certain kind of people are always being asked questions on. So I wanted to keep it open to have more people say, be heard, more people be on this platform to share their thoughts, their experiences. And I don't intend to keep it completely, stuck to medicine or embryology. So we are going to do more of this later. So I would want to, I am very thankful for everybody who had joined us because, we are closing the 25 minutes and we would want to keep it short. everybody has their own me time to go back to. So, to summarize, the impact of social media on healthcare is undeniable and it has its own pros and cons. And nothing comes for free, honestly. Social media is addictive. That is the reason why we ask our children not to be hooked onto it. But it comes at the cost of your time. So, the most important resource today that any one of us can have is our own time. So, choose your time wisely. And thank you so much for being part of this, Jay. And thank you so much, everybody, for being part of this. And we hope to bring some more content to you, which is honest. And I think I will prefer not doing a live because that is too much of a commitment. I can't commit to anything more in life now. So we would want to take pre-recorded videos maybe from next on so that it can be watched at your own comfort and I can create it at my own comfort. Thank you so much, Jay, and thank you so much everyone who had joined us. See you again next time on the next episode of Beyond Norms.
Bye. Take care. Thank you.
Bye. Yeah. It's, what do you mean?